crazy.
Take me a little bit here.
Just a quick test. Testing, 1, 2, 3. Testing, 1, 2, 3.
Sounds good on this side.
Excellent, thank you.
Can you hear us as a test? Okay, Tim's nodding yes. Thank you, Tim.
Who's Tim?
This is a news report from the Bennett building. Some of the protesters have arrived. They have flags and signs, and so far they're protesting peacefully. Maybe not protesting, they are expressing their opinions. And thank you all for coming early and so we can test our system.
One more test.
How many people do we have in the DOC? We have Ronald and
Ronald.
Roger.
So Roger is here and Pam is here in the EOC with me. We're all 6 feet apart.
And that's under test, sorry. That was me. I messed up. Yeah, that's good. Okay, and I'll be right with you.
Hello.
You're unmuted.
Carrie, we're just checking to see everything's working at your end of the building.
Yep,
Okay,
we still have people joining.
okay. And Tori, is she ready to go too? And in the
Yes.
and the EOC, you're connected? Give us a sound check.
I think they're muted. That's where Ronald is.
Yeah,
Yeah, see that? She's muted.
okay. Ronald, can you give us a voice check for everybody there?
She's giving us a thumbs up.
Oh, okay.
I think Carrie has to unmute them.
Anybody else need to check?
The EOC is here, Pam Holmquist, Roger Noble, and Ronald Skis.
Well, thank you. I don't see Dr. here.
So Kyle and Artis are also joining, and they will be unmuted so they can control their own mics.
Is Dr. Habor on?
He's not on yet.
Okay. He's not on yet.
Is that your laptop?
No.
Oh.
There's Artis.
And how do you go back? They given us those little pads like they usually do.
Yeah. Do you
have
need one?
those,
Do you need?
little things handy?
Oh, I can go find you one.
If it's not too much effort, if it is, then I don't need it
Do you
that
need one too?
bad. I actually have one.
Yeah, okay, I'll get you one, Roger, just always gonna pick this up and.
We got the IT person here.
Oh, maybe, maybe.
So Bill, we have all of the board members who are on the call now.
Okay, thank you, and it is 1 o'clock. So I'll call the meeting to order. First, I'll ask for the approval of the agenda. And I'd like to move one item up near the top, slightly out of order. Are there any other changes that anybody would recommend to the agenda? Well, let me note here at the start that the proposed restrictions on bars and restaurants have been removed from the agenda, and therefore there will be no discussion and no action on that. It appeared on an earlier agenda, but is not there today. I'll also make one other comment concerning masking. When we get to the citizens' comments, the requirement for masking, the recommendation or requirement for masking originates in the governor's office. It did not originate here. So comments directed to the health department about our enforcement of that requirement should be directed to the governor, not to the commissioners, not to the health officer, and not to the Board of Health. So with that, let me ask for approval of the agenda.
I move to approve the agenda.
Oh, that's Kyle. There's one. Need a second?
I'll second that.
There's number 2. All in agreement, please signify by saying aye. Aye. Here.
Aye.
Are there any nays?
Aye.
That was an aye, not a nay, so it's unanimous. The agenda is approved. The next item is the approval of the minutes of September 17th, our regular meeting.
Just showing you and I now.
I'll make a motion to approve the minutes of the September 17 meeting.
Okay, thank you, Ronald Lee. A second.
I'll second that.
Okay, thank you. Moved and seconded that the minutes be approved as written. All in favor say aye.
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 Are there any nays? The opinion of chair is.
Aye.
I will slow the process a bit. The opinion of the chairs, the ayes have it unanimously, and we will proceed with the citizen comments again with my comment that the masking requirements come from the governor, and the issue of bars and restaurants have been removed from the agenda. It will not be discussed, and therefore there's no action to take on that issue. So Carrie, can you tell us what we have in terms of citizen comments?
Yes, so there were many citizen comments submitted in writing after consulting with our legal advisor. The written public comments were collected and put into a document that is shared on the website as part of the agenda. We also have 46 people who wanted to give verbal public comment, and we're going to run through them whenever you're ready, Bill.
Okay, as to the written comments, the last score that I saw was well over 100. Is that correct?
I think it's over 200.
Over 200 by now. Well, I saw the first 130 or so.
Yeah.
And with the number of people who wish to speak, can you say that number again?
It's 46 people that we have on the list wanting to give verbal public comment.
All right, if we give them the time for a 30-second elevator speech, that'll take probably about a half hour. So why don't we proceed?
Okay, so we're going to call names down the list and we're going to ask you to unmute yourself. And the first person is Alice Beal. You have just been asked to unmute yourself for public comment.
I'm just gonna watch. I'm good. Thank you.
Okay. So we have a lot of people whose names are not on here. So Anna Greer, if you can unmute yourself for public comment. Anna Greer. Okay, not hearing from Anna. We're going to Betsy Constam. Betsy, can you unmute yourself for public comment? I don't see Betsy on the list, so we're going to go down to Bob Powell. Bob, can you give your public comment?
Hi, Carrie. Thank you. Actually, my comments would pertain to what was earlier in the agenda that had to do with restaurants and bars. So I'll probably just listen for this, if that's okay.
Of course, you can just listen. All right, Bruce Smith, you are up for public comment. Okay, hearing none from Bruce. Camden Neeland.
Yes, my comments also were directed at the bars and restaurant restrictions. So my only comment would be curiosity as to why that was removed from the agenda.
Okay, up next we have Sherilyn DeVries.
Hi, thanks for letting me speak. I'm speaking on behalf of Love Lives Here today, and we have three concerns around the uptick of cases and hospitalizations. One is the protection of people with disabilities and long-term healthcare issues. They deserve to live long lives, and preventative measures help with that. The second is we know that talking points saying that COVID-19 is a hoax or that masks don't work are coming from anti-government talking points, not from reputable medical research. And we know that Dr. Annie Bukacek is actively involved in these groups, leading mask protests and interrupting public meetings. This information, the third is that this misinformation is fueling community resentments, which has led to an increase in angry confrontations, sometimes requiring police intervention, and that's disappointing and dangerous. So thank you to all the Health Board of Health and all the health department employees who are working to make this community safe for everyone.
All right, Chris Weil. Chris, you're up next. Okay, going down the line for Connie Gomez. Connie? I'm going to unmute people just to make sure our public commenters can speak, but if you're not going to be speaking, please mute yourselves again. So next one, we have Connie McCubbins. Either Connie, you can give your public comment.
Actually, I was going to address the restaurants and bars also, so I will go ahead and pass.
Next is Darissa Cowden.
Hello. I want to know, I have a couple questions that I'd like to ask. One is, how many of the daily tests that are being reported as positive are repeats trying to get rechecked to see if they can be cleared to go back to work? And the second one is, out of the amount of deaths that we have, which none is ever good, how many are actually from the hospitalized patients? And how many are from the nursing homes?
Okay. So next up we have David Hart. All right, not hearing from David, we're going to go to Davida Constant. Next on our list is Diane Boker.
I'm also curious as to why the restaurant and bars issue was removed from the agenda. That's my only comment.
Next up is Emily Bayer.
You attend every city council? Not every. Okay, by issue.
Okay, Holly Keefe.
Hi. Hello?
We can hear
Y'all
you.
can hear me? Okay. I just want to bring attention to the fact that the initial numbers of COVID-19 were greatly exaggerated by the scientific community that led to these extreme lockdowns, and that those who are making these decisions often sit in positions of privilege and don't recognize that a lot of people are not capable of being able to economically handle these situations as easily as they can, and are not considering the diseases of desperation, which Flathead Valley is particularly prone to because we have huge economic and wealth disparities due to tourism being a key economic driver. And tourism has, is just one of those things. So I just think it really needs to be considered by the people that are making decisions, that these are having negative consequences beyond the illness that are going to be worse, especially for the disadvantaged, marginalized. And I'd like to make a comment in terms of what a previous person said, that a lot of this doesn't come from people being anti-government. They just want a government that actually works for them and not for lining the pockets of a medical establishment. And yeah, and I'd also like to make sure that churches were included in the bars and restaurants things, because that keeps getting overlooked, that we're having our religious freedom suppressed. Thank you.
Up next, we have Jake Hoover. Okay, going down the line, Jeff Carl.
Yes, I was curious about the restaurants and bars as well. Thank you.
Next, we have Jennifer Hyatt. Jennifer, I can see you, but you are muted. All right, we'll come back to you, Jennifer. Jessica Schrader. Okay, Joanna Adams. Joanna, you can unmute yourself if you want to give public comment.
Okay, yeah, so I had a couple of things I wanted to kind of check up on. First of all, were the churches removed or just the bars and restaurants? So I know that was something that was originally in there. I'm also curious why it was removed and why we weren't informed of that, you know, previous to the meeting, because it seems like we all have showed up. A lot of us have shown up for that particular reason. I'm also really concerned with these meetings being moved to Zoom. It seems like we could accommodate a large group of people at a place like the fairgrounds so people can actually show up and voice their opinion. It's not quite the same if you're on a digital device. I can't help but wonder if part of it is that the board doesn't want to face groups of people who are upset about the increasing regulations that are being put down on us. I'm also curious what you guys are voting on today, if you're not voting on the bars and restaurants, because it was in the agenda to limit event size and I believe increase the authority of the health officer. I'm not 100% certain. My other question would be, what is our goal with increased restrictions? Because at first we were told that we need to flatten the curve. Obviously, at this point, we are far beyond that point. People are going to get exposed. People have been exposed. Tons of people have gotten this and not known because there's a lot of people who are asymptomatic. So I just don't know why we're giving up all of our freedoms. We're giving up our businesses. We're giving up our enjoyment of life for something that it doesn't seem like we can control at this point. I think people are responsible for their health, not the government. Anytime the government gets involved, it doesn't seem to work very well. That's all I've got for now.
Next up, we have Joe Unterreiner.
Thank you, Carrie, and members of the board. I'm Joe Unterreiner. I'm the president of the Kalispell Chamber of Commerce, and we submitted written comments for the record in opposition to the proposed rules on restaurants and bars. Appreciate the opportunity to speak to you today. Thank you.
Next, we have John Weber.
Actually, I wasn't planning on speaking. I am concerned about many of the things that have already been mentioned. And I find it quite interesting that we keep saying the word science, but I think people have different definitions. And it's interesting to me that, well, I don't know which science we're going to be going with here. It seems like the World Health Organization just made a statement concerning some things that are being considered here. So, and that science seems to be being disregarded at this point, although I'm not a large fan or a huge fan of that particular group. Anyway, I plan to largely observe. That's all I have to say at this point.
Josiah Bear.
Can you hear me?
Yes, we can hear you.
Okay, perfect. Well, I just jumped on, so I just got one or two other people's comments. But yeah, I guess my biggest thing, I'm a business owner and can obviously see it from a lot of different angles. But anytime the government starts adding regulations, onto people, especially on something like this. We start crossing a lot of boundaries, and I feel like, honestly, I mean, it's up to the individual person to protect their health per se. Those who want to stay home and shy on the side of caution obviously have that freedom. And on the other hand, we shouldn't take the freedom away from those that want to go out and about and be in amongst people. And honestly, I mean, you know, I see a lot of people on my day-to-day travels, and everybody takes it different. And I respect those who want a more shelter in place, and also those who want to get out and do things. So it's not really the government's right, I guess, to take that freedom away from us. So, and I mean, kind of the other side of the token too is I feel like, obviously, I mean, we're 200 and some days into this flatten the curve. What's the end game? When are we gonna quit saying we need to all shelter in place to flatten the curve? Because honestly, I mean, I feel like it's kind of like the flu. You're either have had it or you're gonna get it. So we're past the flatten the curve, and we need to just let people enjoy their freedoms and let them choose how they're going to deal with it. And I guess that's pretty much my 2 cents.
Next up, we have Kenny Spielman. Kenny, would you like to unmute and give public comments?
I don't have anything to say at this time.
Okay.
Thank you.
Next, we have Lisa Hale. Lisa, would you, oh, I just muted you again, sorry. If you can unmute yourself, you can give public comment.
My husband Charles wants to speak, so won't take up double time.
I'm Charles Heil of Kalispell, and I'm in support of limiting the size of events. Our hospital right now is in crisis. The staff is already overwhelmed. Medical and county health workers are putting in long hours, suffering from stress, and worst of all, feeling like they are not valued by a large portion of their community. There are too many who do not take COVID seriously, and personal responsibility is not working. I served 23 years in the military and protected our country. Those who were drafted had to go to war. During this pandemic, no one is asking our residents to go to war, but they should be able to make a few sacrifices for the good of all. I respect this board and believe you will make the right decision for the health and safety of our community. And thank you for your time.
Next, we have Liz English. Liz, are you on the call? Moving on to Lindsay DeWard.
I want to thank everybody for coming to the meeting, and especially our board members for all that they do. I would like to bring to attention the new study by the CDC, the Community and Close Contact Exposures study that they did, reporting that 70+% of people who wear masks contracted the virus more likely than the 3.9% that never wore a mask. So I'd like to get their take on that and how we can move forward. Thank you.
Next, we have Mariah Diss.
I don't wish to talk, but thank you.
Okay. Mary Ducharme.
Yes. Hi. Thank you for letting me talk. I'm an occupational therapist. I teach virtually driver's training to a couple who is don't have a car. They don't. I mean, they have a car, but they can't drive. They're both on disability. One has a TBI, the other one has a back disability. They're being kicked out of the RV. They're going to the, so far Saturday, they're going to the Arrow Inn. I'm very scared about them going to the Arrow Inn because at least when they're in the RV, they were at least isolated somewhat. And that Arrow Inn is the almost the worst place. Can you make it better? Can we somehow make it better for these places that people end up going to because they don't have any money? And you know, like also the homeless shelter, Samaritan place, the Samaritan House, all these places, you know, you're gonna catch COVID there. And I want to see them on the obit. Thank you.
All right, next we have Mike Kelly.
I'm going to pass on any comment now.
Okay, Michelle Spring.
Hi, I'm Michelle Spring. I'm a physician here locally, and out of respect to what Bill said at the beginning of the meeting, I won't comment on masks or business closures, but like Dr. Camden already mentioned, I am interested in the reason why this body doesn't feel it's appropriate to discuss these proven mitigation strategies. We do have uncontrolled community spread of COVID-19. So I think that this is a reasonable forum, and I may be wrong, but it seems like this would be a reasonable forum to have an actual scientific discussion, period. I'm dictating, sorry. And also I want to say one other thing to one of the commenters that kind of struck me as a little bit concerning. As a physician and someone who has trained in medicine, I just don't view science as being something that people can choose what their definition of it is. Thanks, that's all I have.
Next we have Miriam Maritzson.
Hi, I am a pastor. I serve about 400 skateboarders with a nonprofit here in Kalispell. As a pastor, I also just want to say that science is not a religious matter. We can still make moral choice within science and appreciate that science brings to our community. I want to ask what freedom is. Do I have the freedom to speed on the highway? That makes me feel most free. Is any government or anybody else going to put restrictions on my freedom to speed through a school zone, to speed through neighborhoods? We as a community have made a decision to tamp down on that freedom, to be able to protect others and their health and well-being. We have also as a community elicited seatbelt laws because we are legislating health and the health and well-being of those in cars to wear seatbelts. There was outrage about that when seatbelt laws are passed for everybody in cars, and oh my gosh, you're affecting my constitutional rights and my freedom. But we have found that public health and safety, safety for others in the cars and passengers is important. And so we've made a stand as a community to enforce seatbelt laws. Smoking indoors. Again, are we encroaching on our individual freedoms? Is this a constitutional violation, or is this a response to the public health and well-being of the population? Protecting our children, I can't imagine a nobler moral imperative that we have to protect our children, our elderly, and those at risk. And if this body and our county commissioners say that this is not in their mandate, not part of their responsibility to do what it takes to protect public health, I don't understand the function of their leadership, nor find it to be valid at that point. We must protect public health, and there are so many people right now who are putting themselves, teachers and many others, in harm's way while other people get to exercise their freedom to put other people's health at risk. And I don't think that's freedom. I think that is neglect, that's negligence, and that can be criminal behavior. I think we need to really understand that we need to protect one another's public health. That does not interfere with my freedom. Thank you.
Next, we have Patricia Fogelman.
Hi, thank you for giving me the opportunity to speak today. I'm a chemotherapy infusion nurse at Kalispell Regional Medical Center. I echo Dr. Nealon's curiosity about why the restrictions on bars and restaurants discussion was removed from the agenda today, and my comments were mainly centered around that. But I will say this: we live in a society where we're able to make the choice to drive. We're able to make the choice to drink, but we have a legal and moral obligation not to drink and drive. And I liken that to the current situation. If we don't step up and protect one another, we will all pay the economic price of our failure to win this battle. Unemployment and economic hardship of society and the individual rests in our ability to do the mitigation efforts that will protect us all. And I'm going to leave my comments there for now. Thank you.
Next, we have Randy Sundberg. Randy. After that, we have Renee Dupia. Renee. Okay, Ron Osterbauer.
I'm just listening in. I don't have any comments at this point. Thank you.
Sarah Straker. Then we have Sarah Baker. Either Sarah on the line. Next, we have Sid Dowd.
Hi, I'm just here to observe, learn, and determine how the decisions made here today will affect my role as a Kalispell City Councilor. Thank you.
Now we have Sonia Bard. Sonia, you're muted. All right, we're going to go to Terry Rasmussen. And next up, we have Thomas Bobian.
Hi, we had some bar and restaurant questions, but I wonder how come they are not showing, they do the mass hysteria media and they do the count of people that are tested positive instead of influencing how many people are actually in the hospital. I mean, come on, this is just creating mass hysteria everywhere. And then does the number of people that are contacted, does that get adjusted when we get approved that they were false positives? That's all I have to say.
Next up, we have Tim Harmon.
Hello, my name is Tim Harmon, and I'm the general manager of Majestic Valley Arena. First, I'd like to thank Tanalee St. James Robertson, Lisa Dennison, and the entire staff of the Flathead County Health Department for their tireless work in this difficult time. Management and staff at Majestic Valley Arena have taken and will continue to take health safety of the citizens of Flathead County and all who come to our facility with the utmost seriousness. I have worked with the health department from the beginning of the COVID-19 pandemic. I have submitted COVID-19 protocols for every event we have had to the health department, even though it was not a requirement. As part of those protocols, we have taken the temperature of everyone who has attended our events. As I have stated, the safety of our customers is our number one concern. Customers. As with any business, in order to survive, we have to have customers. Should this board determine that it needs to limit crowd size to 500 persons, Majestic Valley Arena will have to cancel several events. Our events so far have a crowd size of between 1,000 and 1,500 people, although this is nowhere near our capacity of 7,000. In fact, it's 15 to 20% of our capacity, and we have been able to social distance. Majestic Valley Arena, although we have the events, we do not put them on, as it is the promoters who put them on that will be unable to financially operate. So obviously many payrolls and livelihoods will be affected by your decision today, as I'm sure you're all aware of. And I'm also sure that you will not make that decision lightly. Rather than limit crowd size to the points that it's unviable for us to have events, perhaps we could better enforce the current COVID protocols. When I say this, I believe there are numerous areas that could be improved. But unfortunately, primarily, I'm speaking of the governor's mask mandate. We at Majestic have made sure that everyone who has entered our events at our facility has been wearing a mask. As it became apparent at our county fair this year, once in the facility, people take their mask off. It's extremely difficult for private enterprise to be tasked with the enforcement of government mandates with little or no help from the government agencies themselves. Flathead County Fairgrounds could not enforce the mandate, and they are a government agency and hosted an event with over 30,000 people in attendance. Our county commissioners have publicly stated that wearing a mask should be a personal decision left to each individual. What other COVID protocols should be left to personal choice. And yet, private business is tasked with these mandates, the enforcement thereof. Another way to look at it perhaps is private business is penalized because of the lack of help from the government to enforce the very mandates it issues. I believe that limiting crowd size, whether it's at Majestic or local bars and restaurants, or limiting hours of operation, is in fact a penalty. I've talked with members of the health department, with members of medical and scientific community who state that observing social distancing, adhering to other COVID protocols set forth by those very agencies can and will reduce the spread of COVID-19. Would it not be a better solution to help business adhere to these protocols and continue to make payrolls and keep their doors open and their businesses in operation? When faced with helping businesses to enforce current mandates or imposing new restrictions which will severely limit their ability to keep their businesses open, I believe the choice should be obvious. Majestic Valley Arena and the promoters who hold their events at our facility are more than willing to work with the government agencies to provide our customers with a continued safe environment. Thank you.
Next up, we have Tom Millett.
Hello, can you hear me?
Yeah, we can hear you.
Okay, good afternoon. I previously submitted some comments written, but I'll summarize them real quick for sake of time. The first thing I want to talk about is cases. Cases don't matter. I know people don't like to hear that, but here Dr. Scott Atlas, who is a member of the President's Coronavirus Task Force, he said, quote, "The goal of stopping COVID-19 cases is not the appropriate goal. The goal is simply twofold: to protect the people who are going to have a serious problem, that's the high-risk population, and to stop hospital overcrowding." I think we're getting too much caught up in this cases thing. I mean, since when in the history of epidemiology have we ever counted cases? This is insane. Cases don't matter, and it's unreliable also because the number of cases can be off due to false positives, which is something that is never talked about. No realistic goal has ever been given. If the goal is to flatten the curve of cases, then it'll never happen because everyone in the community will be exposed to this. We know this virus only affects serious older people, 70 years of age and older, or those with compromised immune systems. It almost never affects anyone that is young, especially young adults and children. The data proves this. Maybe when this virus was new and we didn't know much about it, it was okay to restrict the movement of people, but now With the available data that we have, there is no justification to restrict the majority of the community, especially healthy people. About hospitals, the hospital beds we have in Flathead County from the latest state report, we have plenty of room in the hospital from that report, unless somebody isn't telling us the truth, because it says only 9% of the beds have COVID patients in them. The available beds are 50%, 50%. Follow the data, people. Also, I'll close with this. Please do not let your emotions interfere with your critical thinking skills. Please don't let the cure be worse than the disease. Please follow the data, and please make decisions based on the best available scientific evidence, as is mandated by the Montana state law. That's MCA 50-11052 Echo. Thank you very much.
Next up, we have Tracy Raquel.
Yes,
Tracy.
thank you. My name's Tracy Rickle. I'm a 57-year-old daughter, wife, mom, grandma, and businesswoman. As the wife of a critically ill spouse, the health department and others have been immensely helpful in educating me on how to care for a person at risk and reduce their exposure to COVID-19. With that said, the effects of minimizing group gatherings, mandating mask wearing, and the closing of our local economy has far-reaching and unintended secondary impacts. Depression, suicide, elder isolation, job loss, permanent business closures, unemployment, and the compromise of our children's education, to name a few. Please continue to offer to help the frail and the weak to protect themselves, and please continue to allow the healthy and the strong to continue to run our community and participate in it. In addition to that, I'd like to note that I choose daily to take the risk of driving on our roads that can be dangerous. I've known people that have died because of driving, but I choose to drive every day because it's part of living in this community. I also choose annually to take the risk of getting the flu by going to stores, eating in restaurants, inviting people into my home, celebrating in large gatherings, attending church on a weekly basis. I do all these things because it's part of living. I take risks and it's part of living, and I'd like to be able to continue to do that. Thank you.
Trina Marie.
Hi, my name is Trina. I just have a couple of comments I wanted to submit here. I have to echo a lot of what Tracy just said. I myself, I'm in my 40s. I'm a businesswoman. I'm a mother, a grandmother, a daughter. I have elderly grandparents in their 80s. But the biggest message I want to say is that I myself, an immunocompromised individual, I have been for many years. However, I have to take 100% responsibility for my own health safety. I've never relied on anybody else to manage that for me. Excuse me. So what I would like the entire board that's making these decisions to understand is, or to think about is, even though we have this situation on our hands, I don't think that we lose the ability to take that responsibility on ourselves. In other words, like Tracy said, I choose to go into the public every day. I choose to carry on with my life. I choose to accept the risk that I may get this COVID myself. If I were to do that, obviously I would take care of my own, illnesses or, whatever, I would have to do that. But I don't expect someone else to take care of that for me. Another thing I want to comment on businesses is, and I know obviously we're not talking about bars and restaurants. However, I am a business owner in the community, and I've read commentary about, shutting businesses down because they don't enforce mask rules and laws and all of this. But as a business owner, I don't think that I should be responsible for making sure somebody comes into my store wearing a mask with the threat that my business might be shut down. because first of all, I don't have dispute resolution, conflict resolution training under my belt, and I would not want to have to go face to face with someone that I told are required to wear a mask and they didn't want to leave my business. So those are just some of my thoughts and comments.
So that's everyone on the list to give public comment. However, we did skip over a couple people who either aren't on the call or didn't unmute at that time. Is there anybody on the call right now who wanted to give verbal public comment who has not yet had the chance to do so? All right, Erica.
Thanks. I'm Erica Langasher. I'm a RN at the hospital. I work both in the intensive care unit and in the COVID unit quite regularly. I also have a master's in public health with a pretty deep understanding of infectious disease epidemiology. And I did write a written letter to the board for their consideration. I mean, in brief, I just want to support the board in their work and believe, you know, what is now a pretty skeleton proposed restrictions, but that I support them. I think there's been so much misinformation offered thus far in this conversation or in these offering of public comments. Epidemiology is all about case numbers. It's about incidence and prevalence. And in this case, our case numbers, there has been a significant pivot, and our COVID unit is more than full. We've expanded and expanded. And yes, there are enough beds. There are not enough respiratory therapists and critical care nurses to take care of the people in those beds. So, and it's also just an astounding piece of misinformation to say the only people that are susceptible to COVID are elderly or otherwise compromised. That is simply not true. And while that's the vast majority of cases that don't fare well, we see young, healthy people succumb to this illness on a regular basis. Maybe not here in Flathead County on a regular basis, but around the world. And what we know unequivocally is that yes, we had a bumpy start to mask wearing and social distancing and figuring out what works to mitigate the spread of this virus. But we know unequivocally that these measures of social distancing, mask wearing, and restricting large indoor gatherings without those measures in place in particular is what can help mitigate the spread. And it's so discouraging as someone who's on the front lines just to see this notion in our community that this is somehow about your personal freedom. It's about protecting the public health of this community and holding each other with high regard. And so I urge you as the City County Health Board to support these measures. And I urge everybody on this call to work together in this and to help us as frontline workers do our jobs well and not be overwhelmed. We do not have enough nurses right now. And that's just the simple numbers right now. So if you want to hear more from me, read my letter. There's a lot more misinformation that's been spread, both by one member of the board in particular, that I feel like deserves clarification and factual evidence in your consideration. Thank you.
Next up, we have Alan Baker.
Hi, Carrie. Thank you for the members of the board for allowing us to have this opportunity to speak. Just wanted to point out a few of the premises that these decisions were going to be based on. And I do have a question. Is the restaurants and bars also include the churches that these restrictions would then apply to? I am, like others, curious why that's been removed. But some of the points. The PCR test is pretty well established that there's at least not a consensus. There are varying opinions about its applicability. There are opinions that, in fact, the founder has been quoted as saying that it wasn't designed for diagnostic purposes. And yet we're hearing much about the case numbers. Is it possible that the dramatic rise in cases is due to the dramatic increase in testing? There's been no tying down those numbers to show that the percent lethality is staying constant. In fact, it's likely, or possible at least, that it's showing that the virus is not as lethal. There are numbers saying that the current survivability rate is over 99%. So there's this decision being made on that premise is at best questionable. Second, the COVID deaths, according to CDC, some documents they put out a few weeks ago, only 10% of the COVID deaths or deaths that are attributed to COVID-19 are due solely to COVID-19. Well, conversely, that means that 90% of the deaths are due to other comorbidities. These deaths would have occurred on the same day, even without COVID-19. So if the same percentage is true locally, and there's no reason to assume it's not, of the 23 deaths that were claimed to have happened here in the Flathead County since October 9th, that percentage only represents 3 deaths. Third, it's well known that there are people out there now who are avoiding going to the hospital. They're scared of what's going to happen if they're labeled with COVID and they don't have it, family members being separated from one another. So the premise that just because the cases are going up means that the hospitals are being overrun, when you take all the evidence into view, that may not be a true conclusion. So my point is that the premises that the proposed health order is being based on, you have to say are at least questionable. There's not a consensus as to what they even mean. We have on the boards of the 2 licensed professional health experts, there's a 50-50 split to what this means. So my point is that given the weight and the consequences of these orders, as has been said already, how it affects things beyond just COVID-19 cases, businesses, freedom of expression, of assembly, churches to meet, so on and so forth. To me, it's unfathomable that we are going to make decisions with such far-reaching implications over data and conclusions that this very public comment section has evidenced, if anything, is a lack of consensus. We need to make a more focused attempt at protecting the truly vulnerable. We need to take more time to really look at what the data is showing us now and not make such far-reaching decisions based on that. Simply put, there's not adequate justification to restrict civil liberties and pre-political rights of assembly as being proposed based on the evidence that's out there right now. Again, thank you for the time to make these comments.
Our last public comment is Brad Griffin.
Hi, Carrie. Thank you for the opportunity to speak. I'm Brad Griffin. I'm the lobbyist for the Montana Restaurant Association, and I do recognize that the proposed rule changes are taken off the agenda. But I just like to state, I'm in Yellowstone County. We have the largest problem in the state, and we are working with our Yellowstone County Health Department to help address these soaring numbers. The restaurant industry recognizes that we need to be part of the problem or part of the solution. And we also recognize that health officials only have a certain number of dials that you can turn to try to flatten the curve here. I just would like to point out that before any further restrictions are put into place, we would really urge the department to enforce the rules that you have in place and go after. We're finding in every community there's 3 or 4 bad actors that aren't following any of the restrictions. They're staying open till 2 o'clock. It's demoralizing to everybody else who is following the rules. And it's just not fair. Those people should be held to account. And I would just encourage that we enforce the rules that we've got. The other thing too that I think is important to recognize is, it's popular to say, well, New York City's doing it or France is doing it or whatever, but we don't have a federal backstop program that's in place right now. There is no more PPP program. There is no more loans to help support our restaurants and bars when they get put down to 25%. I guarantee you 25% is a path towards instant insolvency. Restaurants and bars will go out of business within a month. It's 25%. I don't think there's any business in America that can survive on 25% of their former revenues. So I would just encourage the board to enforce their existing rules. We would like to be part of the solution, and we welcome the opportunity to be part of the conversation. So thank you.
Bill, we did have 2 more people asked to give public comment. I know we are past the time that you wanted to allocate. Do you want those 2 people to get to speak, or do we need to move to the next agenda item?
Let's have 30 seconds each.
Okay.
And don't repeat.
All right. Gary Petro, you're up. Gary, you're unmuted. All right, then we're going to go to Sean Anderson. Sean, you're unmuted, but we can't hear you. All right. So not hearing from either of those 2, I would say we are through public comment.
So still no.
Sean, there you are.
Oh, okay.
I
Good.
can hear you
Sorry.
now.
I'm sorry. I've been juggling microphones all day. I'll keep it quick. I know the 30 seconds. I wanted to just speak up and ask that you please support these recommendations to implement stronger restrictions on public gatherings. It's frankly disheartening that this is even a discussion, considering that our governor has called our county out specifically for its failure to flatten the curve of infections, and that the White House has targeted the state of Montana as a hotspot for COVID infection. We all have the same facts, and I truly, truly don't see any responsible rationale for not applying pressure on our community to do the right thing in the interest of public health. Public health should be an apolitical issue, so it's disappointing to see that a member of this board, Annie Bukacek, is willing to openly speak in opposition to improving public health and to rally public comment in similar opposition. It's disappointing but not surprising that another board member, Pam Holmquist, along with her counterparts on the commission, have utterly vacated all of their leadership responsibility to encourage responsibility and hold extremists like Bukacek to account. It's disappointing but not surprising that this board continues to allow themselves to be made to look like fools. So please do the right thing and support these common sense, life-saving measures. And thank you.
Okay, Bill, that's the end of public comment.
Okay. Well, thank you for the public comments, everybody that participated, either written or orally. We're on to item number 5. There are a number of documents that were authored by John Cole, MD. They're available at the website. And there's an issue that I want to talk to. Okay, I have the old agenda, which is I have number 4, but it is number 5 now. There we go. We're starting the graphics. Would you take us through the graphics, Terry? And I will have a comment to talk about the exponential growth.
Yes, so the first page are the capacity indicators along with some of the numbers. This is also available on our dashboard on the health department's website. We just put it in one place to make it a little bit easier to read. You can see based on capacity indicators, we have diminished capacity in Flathead County. The second page is a graph of positive cases by week for Flathead County over time. The third page is a map created by the Montana Department of Health and Human Services for percent of inpatient beds filled by county, which shows Flathead County at 100%. And then the second to last page, this is cases for Flathead County by month with an exponential trend marking. You can see the last bar is through October 14th for the number of cases we've gotten this month. And then the last page, I will turn over to Bill to talk about case projections.
Can you go back one page?
You want to look at this one?
Yeah, that's perfect. I'd ask our population that's listening in or watching whether they'd recognize an integral if they met one on the street. Or a derivative. And that's what I'm talking about. Some smart person once said, I didn't understand what it meant for probably a couple of years, that the past is prologue. And what it means, I'm looking out the window now, I see a lot of blue skies with fluffy clouds. Well, how about tomorrow? Well, it's not as good a predictor in Montana, probably less so in the northwest corner of Washington, but what's going to happen tomorrow probably is reflected by what's happening today. I'll also add a little bit of my professional background. The members of the board know that I am a CPA. I'll add a little CPA humor that's known to the clients as a constant pain in the ass. So I know a little bit of that. They are often accused us of riding the horse backwards to tell people where we've been. Well, that is important because it gives us some indication, knowing where we've been and where we are at this moment, where we'll be tomorrow. And that takes us to the graph and some little back of the envelope calculations that I did. If you go to the county website, and you have to eyeball this because the scale is not very good. But you'll find that somewhere around the middle of July, and I put these numbers on this chart. In the middle of July, we had approximately 250 cases, plus or minus. The middle of August, the second line, we had about 500. The middle of September, a month ago today, we had about 1,000 total cases. And now we have over 2,000. I think the number today was 2,286. 2,286. So we have
logarithmic growth.
More than 1,000. Now it looks like, if you look at the new cases, it looks like it's doubling every period. So again, back of the envelope, what I did a couple days ago, I took the difference between what I thought it would be at the end of this month, or pardon me, the middle of this month, and subtracted what it was approximately in the middle of July. And the difference, I have a look at my notes now, 90-day period, if you take the difference and divide it by 4 months, you'll find that it's about every 22 days, it doubles. So if you go over to the 1, 2, 3, 4, 5, 6 dates and actual projections, you'll see the first is in blue, date plus 22, and the next is a date plus 30. So the actual dates are the 15th of July, August, September, October. And the light blue is what the mathematical projection is on an exponential function, which is the beginning amount times 2 to a power. So if you go over to the first column over here, the period 0, that's July compared to July. And the next one is July compared to August, and then July compared to September. Finally get down to October. There are three changes in there. And starting from the beginning point, it looks like the period of doubling is approximately 22 days. Well, that's a really rough calculation, so I provided the last column on the right, but what if it changes every 30 days? So if we double 1 to 2 to 4 to 8 to 16, what's going to look like for the next several months if the measurement is 22 days and every 30 days. Well, let's look down to November. If it doubles, it will be roughly 4,000. The 28th of November, 22 days later, 8,000. Late December, 16,000. Middle of 11th of January, 32,000, and then February, 64,000. If it's a 30-day interval, it's month by month by month. Well, by the end of February and March, virtually everybody in the county at this rate will be infected. I don't think that's going to happen because other things happen in the community. There is some immunity, there is herd immunity, there's individual immunity and herd immunity. But it says if we do nothing based on what we've done, all other things equal, many, maybe even most, and perhaps all people will be infected over the next 5 months. So with that introduction, Dr. Cole writes, this was independent of the work that I did on the back of the envelopes, that we're experiencing exponential growth of COVID-19 in our community. And Carrie, if there are any more graphics that illustrate that, I think you had one that you put these numbers in graphic form as opposed to tabular. Let's take a look at those. If you look at that graph, you can see there's a pretty close relationship between the calculated dotted line and the actual line. And if you look at the you can see we exceeded the line in September, and continuing on there, what happens depends on a lot of things beyond our ability to predict and not beyond our ability to control. It's going to happen. So let me turn it back to Carrie, and if you could take us through the presentation of the medical experts that we have lined up.
Yeah, so our first person, we have Craig Lambert from Kalispell Regional. And we'll have to get him unmuted. Craig?
Yes, Gary, thank you. Chairman Berg, members of the committee, thank you. Kalispell Regional Health right now, we're teetering between 25 and 30 COVID patients in-house. We've got more coming in and we're discharging some. I think Erica said it very well. It's one of our nurses. The staffing is by far our biggest issue because COVID patients are very labor intensive, and it's very intense for the staff wearing the PPE and the continuous care. So our biggest issue is staffing right now, the stress on the staff, and continuing to charge on. We have adequate PPE, which is a very different scenario than it was early on in March and April. We're going to be rolling out more testing. In fact, we'll get some of this testing out of Dr. Highbauer's area, but we're going to be able to do about 850 tests a day. We're going to shoot for 7 days a week, so more to come on that because we think testing is very important. We do have adequate beds. The issue is staffing the beds. We're bringing in traveling nurses because the tax on our staff is going to be something that we got to pay attention to because, as Chairman Berg, the slope of that curve doesn't look encouraging, which means that patients are going to continue to be in the hospital. Right now, our hospitalization rate has been 7%. Mortality rate in the valley is somewhere between 0.5 and 1%. Ironically, the safest place for our people is in the hospital, and I say that from the context of staff. We have virtually no transmission of COVID to our staff, but it's an ongoing battle from hand washing to masks and taking all the precautions to protect our staff and patients. So that tends to be one of our biggest issues. Long-term care and the impact for long-term care and staffing is huge because with the outbreaks in long-term care for people who are extraordinarily susceptible to to COVID, they're essentially shut down. So our ability to discharge patients from the hospital to long-term care facilities is essentially non-existent at the moment. We don't foresee that changing substantially in the future. So we're going to have to continue to monitor that. We've got an alternative care facility with 90 beds that at some point, if needed to, we could bring into the mix. At this point, we have not. Tamalee, I want to say kudos to you and your staff. Know you're working your tails off. And now with influenza and all the other reportable conditions that you guys monitor, I see the workload that you guys have is only continuing because we're going to end up in that influenza season. And we don't know what's going to happen from the vaccine effectiveness and what happens with coexisting conditions when you have COVID and influenza. And heaven forbid, we don't want a VRE outbreak. We don't want a pertussis outbreak. All those other things that can dramatically impact the milieu and healthcare ecosystem that we're living in every day. It's been a great dialogue with the schools because, keeping our kids safe as well as long-term care is key. And that dialogue of what the superintendents have done with their boards has been key as well. So with that, Chairman Berg, that's where we're at. We're busy. It's crazy. Stress on staff is real. And we're just planning for this to continue for the long haul.
Okay, thank you, Kerry. Who is next to speak?
I believe that's me.
That's Travis.
All right, Kerry, thanks.
Yep, you're good.
All right. Members of the board, my name's Travis Arn. I'm the county attorney here in Flathead County. I've been asked to chat with you folks today about a few different points. And so I want to make it first of all clear, my office is the legal advisor to the board. We don't lobby with regards to a particular action. The same with the county commissioners. We don't tell them to vote in favor of a subdivision or against it. We just help them understand sort of the legal ramifications of their decisions, as well as the steps that they need to take as they go through the process. So that's our role. We don't lobby. Different branches of government have different roles. Ours is not to advocate in this particular scenario one way or the other, and so I'm not going to enter into sort of that type of discussion. I was asked though to speak on some of the legal principles that come into play when the board is considering an action like this. And this isn't going to be an exhaustive lecture because that would take us weeks, maybe years, but there is, again, there's a difference. Some of the folks have brought up seatbelt laws or drunk driving laws. One point to consider, courts will look differently at laws that have been passed through legislative action versus laws or rules or regulations that have been passed through simply an executive order or through agency rule or regulation or health officer rule or regulation. So that's something to keep in mind. Again, here's just a few basic principles that aren't in any particular order in terms of importance. First, the board and the health officer's authority to act is grounded out of statute. And so there's limits with regards to that authority. There's limits as far as to when that authority is triggered, and then if the authority is triggered, what sort of steps the board or the health officer can take. For the health officer, in order to create a new rule, there has to be an imminent threat. And so there's going to be a legal question as to whether or not what we're dealing with is imminent. And different courts will have different answers with regards to that. And then if it is imminent, okay, what steps are you allowed to take? What sort of action can you take? Can you limit group sizes? Can you eliminate certain types of businesses from operating? Those type of things. The effect of any new rule is to criminalize behavior. So something that was legal yesterday is now going to be illegal upon the passage of something like this. And when that kind of action is taken and it infringes on constitutional rights, such as the right to assemble or due process taking stuff, if religion was included as the previous measure was involved, the action is going to be heavily scrutinized. And there's no question that the government restricts or infringes upon certain constitutional freedoms all the time. You have the right to assemble. You can't do it in Main Street unless you have a permit. So it's not a question of if this is a constitutional right, then the government can't act. It can. But when it does so, typically the very brief sort of analysis is there has to be a compelling interest, and the action taken by the government has to be narrowly tailored to address that interest and not go beyond what it needs to. And all of this has to be sort of backed in science and data in terms of your decision. So with regards to group sizes, and I'll just address that since that's the one that's left on the table, what's the science behind the particular line that's been drawn? A line at 500, someone will say, why not 1,000? Others could push back and say, oh, no, we could have drawn the line at 250 people. That's not our role. That's the folks, you folks, in terms of your expertise. But you will have to articulate, okay, why is it that we chose to draw the line here versus somewhere else? You'll also have to articulate why you've excluded certain groups from others. So why aren't youth activities included in this rule? Again, not for me to answer, just you folks will have to be able to articulate those reasons. Finally, the last point that I was asked to talk about or address enforcement. When it comes to a civil action, looking to enjoin someone or do a health order on somebody, a particular business, that civil action can be addressed by both my office or the state through the Department of Public Health and Human Services. They can pursue those types of actions. When it comes to criminal matters, then that falls only to either my office or the Attorney General's office. Enforcement is always going to involve the discretion on the part of law enforcement. People expect that. People hope for discretion and leniency whenever they get pulled over. They hope for the warning from the officer rather than the ticket, the criminal process, which brings in the right to due process. And on some of these health board matters, it does involve some of these violations can involve jail time, which would then mean the public defense system comes into play. The bottom line is there's going to be, anytime you create this rule, if you're looking for enforcement, when it comes to a criminal approach to things, that'll again fall to my office. We'll use our discretion, and when we do so, you need to know that we're going to be using our discretion to make sure that we're making wise decisions, both with regards to folks' constitutional rights, as well as the taxpayer dollars that go towards our office. So those are the basic points. I can answer any questions, but frankly, I can't get more detailed than that. Otherwise, we'd be here for a couple of weeks. But I am happy to do what I can to address any short questions. Thanks.
I think we'll hold all questions till the end of the last presentation. Thank you.
So next we have Micah Hill.
Could you introduce Micah?
I am with you. First, thank you, Chairman and board members, for the incredible efforts of the Health Department, along with the administration and staff of Kalispell Regional and North Valley Hospital, in supporting our schools and community. I'm Micah Hill. I'm Superintendent of Schools in Kalispell and belong to another group called the Northwest Mass, which is representative of all the superintendents in the Valley. And we're grateful for what you have done and recognize the strenuous demands placed on your department during this time. And we appreciate the hard work and collaboration in support of our school communities. I think it's important for the board to understand and our community to understand what school district's goals and priorities were. And in August, the Kalispell Public Schools Board of Trustees unanimously voted to support the return of in-person instruction. Many advocates and the CDC recognize, and we also agree, that aside from a child's home, no other setting has more influence on a child's health and well-being than their school. It's widely recognized by our school leaders that in-person instruction provides the best opportunity for our students to have the highest quality educational experiences possible. We also recognize and value the countless benefits our schools provide to our students beyond academics, including social and emotional support, resources and services, participation in activities, nutritious meals, and much, much more. Remote instruction, while a temporary substitution if necessary, simply cannot replicate the authentic experience of in-person instruction. Additionally, we recognize the sensitive role School District 5 and all schools in the Valley play in the bigger picture for our families and broader community. Our schools represent a critical piece of the social, emotional, and economic puzzle of our community. And whether our schools are open or closed greatly impacts our families and community, creating an inevitable ripple effect. For our families, having schools open allows parents to work and alleviates the responsibility of managing their child or children's remote learning, which can be an overwhelming task as we experienced this past spring. For our community, KPS parents' ability to work is foundational, enabling businesses and organizations to remain open, keeping our local economy going. Working parents teach in our schools and partner districts. They staff our hospitals, our emergency services, our businesses, service industries, and more. If we close, requiring many working parents to come home with their young students, we are directly impacting those organizations' ability to serve our community. We also knew that it would be difficult to completely eliminate the risk of COVID in our schools. We are prioritizing the health and safety of our students and staff. The risks associated with COVID-19 are continually being weighed with potentially greater consequences for our students and families and community if our schools are closed. Therefore, we have endeavored to make every effort to keep our schools
5 in open. the west. I need someone to take this day off. At 5 in the
Our staff has worked incredibly hard to make in-person school an option for our students. This has required shared responsibility, flexibility, and teamwork from both staff and students who have done a great job following safety protocols. Our local health department has reported these protocols have demonstrated effectiveness in preventing COVID-19 spread within our buildings. We are very grateful for this and credit these protocols for enabling us to remain open. While the number of cases associated with schools is not insignificant, almost all cases within the schools have been traced to outside of school exposures as opposed to revealing transmission within the school environment. However, outside of the school setting, Flathead County cases continue to rise. Our health departments report transmission where safety protocols are not in place or are not followed. And simply put, if we cannot mitigate the spread in the broader community, we are absolutely at risk for closing our schools for in-person instruction. While we have managed to remain open up to this point, we are continually faced with new challenges on a daily basis that require us to reevaluate and assess our approach and the ability to keep schools open, and could make this decision to close at any point. Clearly, our priority is to protect the health and safety of our staff and students, many of whom have underlying health conditions. Our hope is to minimize positive cases within our school community as much as possible. And with each positive case, we have concern how that might impact each individual and family. Adequate staffing issues continue to be one of our biggest challenges. As cases continue to rise in Flathead County, this has a direct impact on our school community. Not unlike other businesses that have had to close, we've had many staff out for periods of 2 weeks at a time due to the need to quarantine, the need to care for their child due to a school or childcare facility closure, or for positive COVID test results. And while our staff and substitute teachers are working incredibly hard to provide coverage, our pool of substitute teachers isn't very deep. And quite frankly, people don't want to substitute when they risk exposure to themselves or their families. For every positive student case within our building, there's a significant ripple effect where 12 to 20 students are deemed close contacts and removed from the school for 2-week periods of quarantine. This constant flux of students and staff in and out of the building presents incredible challenges for both staff and students. Teachers are tirelessly and creatively figuring out ways to keep the momentum of instruction within their classrooms, but there are limits to what we can ask of our employees. If the cases within our schools increase and/or follow the current trend we are seeing in our county, we will likely be forced to make the decision to close, not because of transmission in schools, but because the transmission in our county is so high that it affects every aspect of our ability to remain open. When cases and quarantines affect our custodial staff and our food service staff, we cannot adequately clean or provide the meals to our students that they have come to expect. We're asking for help. To be clear, this is not about politics or personal freedoms for schools. We are legally obligated to abide by the directives of the governor and those agencies that have authority over school districts. To not do so would be irresponsible and subject the districts to liability and potential legal battles that ultimately the taxpayers of this county will have to pay for. We are not doctors or medical professionals or epidemiologists. We're education professionals caught in the crossfire of political activism and a health pandemic. Simply put, we cannot do this alone. We need community help in keeping our schools open. We want the community to know how important it is that everyone does their part, sharing in the responsibility in mitigating the spread of COVID-19. We are working hard within the school setting, but ask that our community takes this seriously by being responsible and safe in all settings where there is potential exposure and interaction with others. Kalispell Public Schools and all of my colleagues in the county are in support of taking the necessary precautions within our community to help slow the spread within our community. We have never said that wearing masks, watching your distance, and washing your hands would eradicate COVID. What we have said is that it will slow the spread. And the slower the spread, the less impact on students and staff, which leads to the greater chance that we can remain open. The data from within our district greatly demonstrates that fact. When we look at what is happening in our county, and without greater support from our community, the lack of support for the basic measures that have been asked will present a greater consequence for our students and community. The local businesses and patrons that choose not to help slow the spread will suffer the consequences of school being closed. We greatly appreciate all the support from our health department and our community in helping to keep our schools open. Thank you.
Thank you.
So we asked law enforcement to speak. Sheriff Brian Hano is not available, but Wayne is here from the Sheriff's Department. Wayne, are you able to unmute and speak? I'm not sure that Wayne has a microphone on. Let's just give him a moment. All right, I'm not seeing anything from Wayne, so we could go next to Dr. Jaden. Dr. Jaden, you're unmuted.
Yeah, this is Dr. Jaden. A lot of the comments have already been repeated there, so some of this may be just some rehashing of what's already been said. I'm the only infectious disease physician in the Valley. I also have a master's in public health and epidemiology as well. So I do actively look at these numbers, and unfortunately, a lot of what I'm going to talk about is going to involve the numbers of cases and rising numbers that we're seeing, because I think they're critical to what we're seeing both globally as well as locally. Just to remind everybody, globally, we're almost at 39 million cases and 1.1 million deaths. The United States makes up the majority of these cases. We're at 7.9 million, but India is rapidly rising and closely approaching our numbers. Even areas of Europe that initially were impacted and seem to have lower numbers of cases are starting to see rising numbers of cases. So this is an ongoing pandemic and it continues to be with it. In Montana, we've seen a rapid rise in our numbers of cases over the last several months. We currently have almost 21,000 cases. But that's kind of, as we've seen, an exponential increase where we had an additional 4,000 cases this week, 3,000 the week before, 2,000 the week before that. So we've seen a really dramatic rise in the number of cases. Fortunately, our deaths have been lower. We have 230 total deaths. But there's a couple of key things, I think, with this. If you look at the total number of cases, we're actually at the bottom 8 in the state. So it looks like we're doing pretty well. But if you look based on our population, that's where I have great concerns. And so if you look at the number of positive cases and things that we've had over the last 7 days per 100,000 population, we're number 3 in the country. So we're very high rates that we're seeing. And the other states that are number 1 and 2 are North Dakota and South Dakota. And North Dakota and South Dakota have the highest. They're number 1 and number 3 for the number of deaths per 100,000 in the United States. And so I don't want to see that trend happen for Montana, but we're seeing a rapid rise in our numbers of cases. And we're the number 2 state as far as testing rates for positivity. And the White House Task Force has identified Montana as a state of concern for the numbers of cases that we have there. For Flathead County, we're at 2,286 cases. Again, we went up 600 cases this last week. It was 400 the week before that, 300 the week before that. So you see that exponential growth with that. But the more important part of that number, I think, is the number of active cases. And so we have 1,264 active cases of our almost 2,300. So 55% of our cases are active, ongoing right now. And what an active case means is that's a case that can potentially transmit and give this virus to other places. We know that Yellowstone County, where Billings is, certainly has the largest number of cases in the state, but they only have about a third of their cases being active. And if you look at Gallatin County, which is where we kind of initially saw this and had dramatic rises in cases, only about 15% of their cases are active. So our 55% is very concerning to me. We're getting about 85 cases positive a day, and it was 60 per day the previous week and things there. So we're just seeing this dramatic rise in our community with it. As far as our hospital, I would just echo the comments that our nursing and leadership has already provided and things. We currently have 29 persons that are admitted to the hospital with COVID-19. And again, the age range is varied from the ages 20 to 90s. So it affects all ages, but predominantly the more serious diseases in the vulnerable population and age over 65. But there are people that even with mild illness have a post-COVID syndrome where they're really debilitated with significant fatigue, chest discomfort, feelings of shortness of breath, headaches and things that can linger for 2 to 6 weeks with mild cases. And with more severe cases and things can last as long as 3 to 6 months. So this is a very debilitating illness, and it may have long-term health impacts that we're starting to have registries to follow these people, but may have long-term impacts to their lungs, their hearts, potentially their kidneys. And so these are long-term things that will potentially affect people, and even people with mild illnesses and things from that. I was just going to make a couple of comments from some people that had commented earlier, just on some additional information and some clarification. There was a mention about a CDC study in the Morbidity and Mortality Weekly that looked at COVID patients, and it was looking at exposures. And what I've seen in a lot of reports and things coming out is what the highlight of that study was that they noted that 70% of the people were wearing masks that actually got COVID compared to a control group. But there are other factors involved in that those persons that got COVID were 2 times more likely to have gone to restaurants or bars or coffee shops as well compared to the control group. And then if you further look at it, the people that got COVID that reported wearing their masks well when they were in these other social areas reported poor usage of masks by other people around them. And so it's really a chain of events and things there. It's not just the mask, it's not just any one of those, it's all of those pieces together. And so you need consistent masking, you need consistent social distancing, you need hand hygiene, you need frequent cleaning, you need these high touch surfaces, and then you need to avoid these large gatherings. It's really all of those links together. And I think the final point would just be our hospital, as far as the beds and our testing capabilities, has really done well. We're expanding our testing capability with that, and our PPE has been available and things to us. Really, our limitation is in staffing, and it's staffing at all levels, ranging from environmental services to the respiratory technicians, phlebotomists, nursing, and all of those providers and things from those. These patients do require a lot of care in addition, and so it really requires all of that support. And so it's concerning that we're averaging 25 to 30 patients and things now, and we're projected within a few months to have 40. A lot of the hospitals throughout Montana are already limiting some elective surgeries, and they're already well beyond capacity. And so I just would really like to impress upon the community just to really be mindful of these things and try to mitigate these so that we can protect our public health sources. And I'd just like to thank the board and thank the health department for all of their efforts in this.
Well, thank you for your participation. Can you stay on for a few minutes?
Yes.
Okay, thank you. Carrie, back to you.
All right, so that brings us to our next agenda item, which I think goes to Tamily.
The next agenda item is a discussion with the board about mitigation measures and what would we think that would look like and what suggestions would we have. We've had a lot of discussions with the local public health officers in the state, and we believe the public health message has become white noise to our communities. They know our message: social distance, wash your hands, don't go to school if you're sick, don't go to work if you're sick. At this point in time, public health cannot stand alone. We need to have our partners engaged in the process. And that's, we know the important things in our community are to protect our schools. We know how important it is to keep them open, to have our children in schools. The schools here have been doing a fabulous job of protecting our children. Their cases are coming from activities that they're engaging in outside of the school settings. We need to protect our hospitals. We need to protect their staff members, so they're not contracting COVID in the communities, and their children aren't, because then they have to miss work, has been talked about by several of the speakers today. And we realize we need to keep our businesses open. It's important to have a vital community and economic community. And we realize it's tough for a business to make it in small communities in Montana, especially in the Flathead. We know it's important because we have like 4 or 5 really good months of business, and then, you know, we need to be able to make it through the winter. That being said, I want to talk a little bit about health officer orders. It's not as easy as the health officer deciding, you know, there should be a health officer order. There are many moving pieces to that. First of all, does the sheriff's department or the law enforcement, do they have the staff to help enforce that? And do they have the will to help enforce that? Second piece is the county attorney's office. You know, when we're looking at a health officer's order, we have to look at, is it legal? The mitigation strategies that we're doing, is it legal? Is it enforceable? We see a lot of problems with the governor's mandate on masks. You know, is it enforceable? And the other thing is it defendable in a court? We have to look at all of those points when we do a health officer's order. It's just not as simple as the health officer saying we should do this. So what we need to talk about now as a board of what are some strategies that we want to try to move forward with. This is not a decision that the health officer is going to make on their own. We need to engage the board in this discussion and try to figure out what the best mitigation strategies are for our communities. I don't think there's any silver bullet out there. We have, if there were, we'd know about it and we would know what to do, right? We're in the middle of a pandemic. It keeps going on, our numbers are rising, and honestly, I'm open to any suggestions of mitigation within the community. I mean, our community is very polarized on what to do here. If you want to look for studies, you can find a study on either side of this aisle. So I'm open to any suggestions or what we think that we should do as a board as far as mitigation to help our schools, hospitals, and our businesses and our long-term care facilities.
But we're not already doing.
Right.
To even discuss mitigation strategies, there's a couple more things I think need to be said. I mean, public comment isn't everything, but it does matter. And in the final count that was handed in about 11:30, there were 162 of the public that were against more regulations and 106 were for. So that's a large majority, but that's not my primary point. But the primary point, I want to address what the county attorney talked about, because I think his discussion was the most practical and reasonable. And Tamala, you're reiterating some of the things as far as the difficulty of mitigating. So to put in perspective, which I think is very important, there's been an exponential growth in testing that outstrips the positive tests, okay? So June 23rd, almost 74,000 tests were done at that point. By July 25th, 149,000. By August 25th, 233,000. September 25th, 326,000. And now 414,579 COVID tests have been done in Montana. That's a six-fold increase in testing in that short period of time. We have 1,068,000 people in Montana, so 414,579. We're getting close to half the population of Montana if health departments aren't, double dipping and doing people more than once. So anyway, it's been an exponential growth in testing, and I think that's really important. And then if you look at the percent death rate in Montana, based on the data, government data, CDC data, it's 0.02% death rate. If it was 2%, that would be 2 per 100 of our population. 0.20% is 2 per 10,000. And that's if you believe the CDC data, which not all of us do. So statistically, for practical purposes, COVID-19 in Montana has 100% survival. So when the county attorney talks
No, it doesn't.
2 out of 10,000, 0.02%, that's pretty close. Please don't interrupt. So that means, you could say 0.02 out of 10,000 if you want to. I consider that statistically to be close to 100% survival, all right? Statistically, I'm not saying that the people that died don't matter. So in terms of an imminent threat, I've never seen anything with such a low death rate. In the history of virology, I've never seen a virus that doesn't preferentially affect children. This one doesn't affect children in a meaningful way. Now, Tom Millett and other citizens commented about cases, and they were put down by a couple of the medical people who should know better, because he's absolutely correct. And a case simply means a positive test. an active case means a positive test that's being quarantined, even if they're self-quarantined. You know, any seasoned medical professional knows that before COVID-19, we never called a positive test a case. If it was a case of tuberculosis,
I'm going to excuse myself from this. This isn't, I'm not of help for this. So thank you very much for your help.
I think that's about all I had to say. I think I got it in there. There's other things I could say too, but that's, I think, the most important. Imminent threat, because like the county attorney talked about, and like Tamalee alluded to, I mean, how are we going to enforce these? Every good manager, every good military officer knows you don't give an order you can't enforce. And even in the Montana counties where the sheriffs would enforce lockdowns, which they wouldn't do here, you know, what about a cost to the DA? Tamalee talked about it, the health department, you know, the cost would be dramatic. We can't enforce it. Thank you. I'm done.
Okay, well.
You're very
kind. Excuse me, this is Commissioner Holmquist. Could I say something?
Yeah, Pam, go ahead, and we're going to go around the board.
Okay, thank you very much. First of all, I just want to thank everyone that has commented today. I take everyone's comment very seriously. I think that we have seen an increase in positive testing. I think it is somewhat due to that there is more testing being done, but it's still a fact of life that we have COVID in our community and that our healthcare facilities are being stressed, and it's hard to find workers. The health department has done an amazing job trying to keep up, and we just can't find workers to continue that. I agree with Tamalee in that, you know, our community, it's so hard to see our community so divided on this issue. I think that there's science both ways, and people have the right to believe the science either way it goes. But at the end of the day, I think we would have a hard time moving forward with restrictions over and above the directive of the governor. I think that could present some real legal challenges to us. I also believe that you know, our community is divided. What I would like to see, and what I would recommend, I guess, is for mitigation, is that we as a board try to come up with a unified message that recognizes that individuals have some freedoms, individual freedoms, and still ask our citizens to do what they can to help slow the spread by just doing what they can or what they feel comfortable doing. I think the data is out there that our healthcare facility is concerned. We are going into a flu season, so there's concerns there. I think that we're not only, you know, tasked with serving our county, but we're possibly going to be taking on patients from other counties, depending on what happens here and how this virus does in the future. But I'm concerned if we start picking and choosing who we're going to restrict. And I think even with the 500 or less, you know, not being able to do that is not fair and maybe a little bit discriminatory. And I don't know that a court would hold up that. So, but I still think that we as a board need to try to help as best we can. I think right now the only way to do that without creating some other problems is to unify. And what I would like to suggest, if at all possible, is that I would be involved, Tamalee would be involved, and the two doctors on the board, Dr. Habor and Dr. Annie, could come together in a meeting and figure out a press release, send it out to the board, see if they're comfortable with it, get more information back from them, and see if we can't just unify. I think if we can unify, maybe the community will be a little more unified. So, you know, we're living in a horrible situation right now, and unfortunately, there are many things else going on in our community that shouldn't enter into it, but they are. And so anyway, that's my spiel, and maybe I'll have something later, but I guess that's what I would suggest, is just a unified message at this point and see how that works. Thank you.
Okay. Oh, okay. Dr. Haybar, do you want to speak now or speak at the end?
Wherever you'll have me. Can you hear me okay?
Loud and clear.
Okay. Firstly, I apologize to Dr. Bukacek. I let out a exasperated emotion, and I did not mean to interrupt. I forgot that I was on mic, and so I apologize for interrupting. I shouldn't have done that. So, I mean, I think so. What we're hearing is that what's going on right now is not working. There's been an appeal to let people read the science and figure out what they think is best, or do what they're the most comfortable with. That is a lot of the sentiments that are being shared by some of the public comment, that people should be able to be free to do what they think is best or how they interpret the science, and that there's more than one science out there somehow. And we see the ramifications of that thinking right now. And that has been done by Bill when you first led into this. I think, Bill, you've got a budding career as an epidemiologist. I mean, you can see the results of what the status quo is doing. So we know the status quo is not working. And then so looking around in the other entities that have a stake in this, that have the ability to do something, the governor has said he's not going to do something additionally, and he has tasked additional measures specifically to the local health authorities. And now we can we can say whether or not that was right, or the politics of that, but the point is, he said that he's going to stay out of it. So what we know right now, do we need to take a break? 3:30. Okay. What we know right now is what is going on is not working, and that the current rate of logarithmic growth will have huge impacts going forward. So we have the opportunity now to try and make some steps to mitigate spread and to slow down the growth rate, so that we can keep our schools open. Nobody wants to close businesses. Nobody wants to restrict things. But what is the alternative? I think what I'm hearing is the alternative is to keep doing what we're doing, and we all see that that's not working. We're hearing from all of our medical colleagues. We're hearing from the nurses and both in the public health and on the bedside, that are just exhausted from this and see no end in sight and see it worsening, that the current interventions are not sufficient, and that just letting people appealing to people's doing what they think is best is not working. So what can we do that would have some meaningful interventions to slow this down? And I'm sorry that Dr. Jaden left, but we know that gathering in large groups, viruses spread amongst people. And so we know that gathering in large groups gives opportunity for the virus to spread. And we know that that's even going to be more so the case once we move indoors. I think we were spared a lot of the brunt of this through the summer, because a lot of our activities were outdoors. We're Montanans, we do things outdoors. But even us diehard skiers are going to have to go inside at some point in time. And I think that there's a huge concern about that. So I guess I just want to appeal to the rest of my board members that I think it's clear that what's going on right now is not working. And if we leave things as they currently are, we are doing our community a disservice. And we're being asked to step up and take the lead on this. And even even though we may be challenged on it, and even though people may not like it, we need to try and do something. And that something needs to be wise and it needs to be legal, but we need to take some steps where we can, because I think we're on the hook if we don't. And the fact, certain arguments of people being tired of restrictions, we're all tired of restrictions. We're all want to have our lives back, but the virus doesn't really care about our feelings. It's not going away. People are going to die, even more so if we as the public health and the board that supports it don't try and do something.
Well, thank you for
That's what I've got for now.
Thank you for your comments. Just an administrative matter, the board members know that we have an executive session starting at the end of this hour. It's supposed to be in 6 minutes. We've delayed that till 3:30. So we have another 36 minutes to finish this meeting, and then we'll go on to the next. So Carrie, why don't you pick someone else to make a comment before we get into discussion of the health officer's order.
So we'll go down the list. Next up, we have Artis Larson.
Okay, I want to thank everybody for all the information that you guys have given us and so forth. The one thing is I really wish that we would have had how many tests we had done for those weeks. We have these numbers, how many positive, but we don't have the tests were actually conducted. So that would have been kind of good in this report. And so another thing is I do agree with Commissioner Holmquist. I think maybe what we need to do is do a press release and maybe get Tamale and Pam and the two doctors together and come up with something like that. And so that's all I have to say, so we can get to our next meeting.
So I interpret that you'd like to focus on encouraging the population to do what they should be doing all the time, should have been doing all the time. Separating, wear a mask if you feel comfortable, wash your hands, use antiseptics,
Yep.
right?
Yep.
To shame them into acting. We have a right to assemble, but we don't have a right to spread the virus, if I can say it that way.
Yep.
We need more people to feel that way.
Yep.
Okay. Carrie, take it away.
Next, we have Roger Noble.
Okay. Well, I guess, yeah, thank everybody for all the comments provided today. And I guess the takeaway that I'm getting is, there's a pretty consistent message across the board with the medical community that this is a major concern. And the fact that all their numbers seem to be real consistent in the number of beds that are occupied in the COVID unit right now. The fact that we have, I think, about 60% occupancy, that only leaves 40% as a buffer or kind of a safety factor. I don't think that's very much of a safety factor. And I heard from a number of the healthcare providers that they're pretty stressed and the medical resources are getting pretty limited, not in service, but just in the number of providers available. And I know this for a fact too, that it wears pretty hard on those people. So I think that's an important consideration, definitely. I mean, you only have so many people that can provide these services. And then I do echo the concern too that with the upcoming flu season and then having COVID out there at the same time, this is going to could have a pretty substantial cumulative impact. And I think that's a very important thing to consider. I guess I know for a fact too that we had a job that we were going to do next week, and it was with the FAA, and they were bringing people in, and they called me yesterday and said, we're canceling because you're a hot spot. We can't bring people in here. And then the alternative was, okay, we're gonna put people in, or let them bed or have accommodation in surrounding counties. Well, all those counties are hotspots. So my whole project got canceled until next year. So I think it's being recognized just not in the community, but nationwide, that this area is on the high, it's colored red, you know? So I guess, and I take, I guess, the fact that the county health officer feels that there's a necessity to move forward with some sort of plan. I guess I would support that. And it sounds like from the county attorney that in order for this to be approved, we have to have rational justification for it. And so I guess I'd have to put it back to Tamalee and Carrie or whoever developed this to further explain how some of these numbers were developed, because I think that's the question out there. The 6 foot distancing, that's a given, that's a no-brainer. But the 50 and the 500 limits, I guess if we could have more information on that to justify it, I'd be interested to know that. So those are my comments.
Carrie, go ahead.
All right, if we want to keep rolling through board members, next up is Ronnalee Skis. And again, we're on agenda item number 6. So we're still talking about that proposal piece.
Thank you for calling me out. And we are talking about the mitigation options on the board discussion. Is that correct?
Correct.
All right. Thank you. You know, I have been reaching out to a lot of people, including those who are on the front line working with people who have COVID, who've been tested positive for COVID, restaurants and businesses that are suffering the loss of business, loss of employees. This is impacting our community deeply and in a lot of ways. I also recognize that I have close friends who currently have COVID and are at home waiting for them to get well enough to become part of our community again, as well as close friends who have lost family members to COVID. COVID is real and it is impacting us. If we're talking about mitigation options, I would suggest that what Commissioner Holmquist was saying on having a unified message. What is our message? What are we trying to say to the community? I think a part that is missing is transparency. We are not as transparent with the community as we really need to be. I think transparency starts to relieve some of the scare, some of the fear, and it allows for people to see what is really happening, as well as recognize that there are people who are hurting. Transparency in all of the areas of all of the data that's available. As Artis Larson just mentioned, we need to know how many tests, how many repeat tests. If people in the community have those numbers, I think that we're going to be able to grasp what we are dealing with a lot more clearly. You know, here we're all Montanans, and Montanans have a unique way of taking care of each other, of taking care of community. Montanans, we do care about our neighbor, but right now we've become us versus them in this fight of COVID. And that needs to be ended. We need to have a conversation around how do we protect the most vulnerable? How do we continue to let those who need to work safely? And how do we address each of us caring for each other without feeling like if I'm wearing a mask right now, or if I'm not wearing a mask, I don't care. Those are not the right messages that we need to be out in the community. So if we're talking about mitigation, yeah, transparency. We need to talk all of the information that the community needs to make good choices and good decisions so that we can continue to be those good Montana neighbors that we truly are.
End the paragraph.
End of paragraph. I'm sorry, I'll drop the mic.
Okay, Kyle Waterman.
Thank you for that. Thank you for all the public comment that we received, but also just the comments of fellow board members. I mean, I do think that I agree with what Ron Lee is saying. I mean, we have to find ways to be able to bring the community together. And that's going to take a little bit of our communications and how we can do that. I would encourage either the commissioners, and if it's not going to be the commissioners, I would turn to my mayor to see how we can also make sure that we're engaging with business community and our places of worship to make sure that we have a committee really being pulled together of pastors, of bar owners, of restaurant owners to really talk about how we can pull together as a community and change some of this conversation. If we don't bring our numbers down, which are, I believe, comparable to where Florida was in June, we're going to end up entering into winter and having a significant health event on top of a second health event, which is our winter. Winter in Montana is significant, and we need to be able to find that. But I do think we need to look at how we are also looking at enforcement of the rules that already are there. We have businesses and community members who are performing well and complying with those, and then we have some businesses that are out of compliance. And I would also hope that we would look, and the commissioners would look at how we could engage our law enforcement and our legal department into upping up what we can do in enforcing compliance with the regulations that are there today. But again, looking at how we can engage with the community, because I do believe that, yes, we can find a Flathead way to solve this. We don't have to wait for somebody else to tell us. We don't need to wait for the governor to come down with a mandate. If we can pull together as a Flathead community, we can find a way that we can do this. So I'm supportive of the commissioner pulling together the doctors to be able to find some of that Flathead message of what we're doing. But we need to be able to get the community to understand that if we want the ski hill to open up, if we want to get through this winter and we want to get into next year, we're going to all need to come together and come to a way to keep together as a community and solve these problems.
Thank you, Kyle. Go ahead, Carrie.
So there hasn't been a motion from any of the board members, so you can have further discussion. You could make a motion, or you could choose to go to the next agenda item.
I guess I could make a motion. I move that we do not move forward with, which item is it? Which item is on the agenda?
6.
I got number 6. I motion that we do not move forward with item 6 on our agenda today.
But I guess maybe there was a question. I mean, not to that the Tamale could explain the rationale behind those, as was the question, I think, from Roger as to why these were chosen as to risk mitigation strategies.
I think that's in item number 7.
Oh, okay, I apologize.
Yeah, that's all right. Just
Let me address
okay.
it.
Go ahead. And finish.
I've had the question asked several times, how many of the tests, how many of the tests are repeat? Not many of them at all. We see every positive that there is. We do an investigation on every case, and we've had very few that were repeat tests. And that's because if somebody tests positive, you will test positive for up to 90 days. And so there's no reason for anyone to be tested again. So that's kind of misinformation out there that a lot of our tests are repeat tests, because they are not.
And if I can speak to that as someone who orders those tests on a regular basis, there are some times when a repeat test would be indicated where you have an illness or you had an exposure to somebody, a close exposure, and then with just the increasing number of people that are positive cases, that you had an exposure to somebody else 3 weeks later. And so there are times when people would have a repeat, where it would certainly be reasonable to have a repeat test, not just fishing for trying to get a positive.
And if I could say, I think it's not just repeat tests, it's also how many tests. Because, you know, early on we were testing smaller numbers and now we're testing larger numbers. And I would like to have the percentage of how that is affecting the numbers. You know, are we doing way more testing now than we did in March? Are we, you know, I guess that's kind of a question.
This is Tammy. I can send out that graph. We have a week by week positivity rate and the number of tests. That has steadily been climbing. Our positivity rate has steadily been climbing. In fact, it almost mirrors the one graph that Bill had prior to his information. I'll send that out to you.
Great. How far back does that go?
It goes back, I think, to March.
Okay.
And this is kind of a point to grasp with that as well, in that as the prevalence in the community increases, your positive predictive value of the test is going to go up as well. So earlier on, when our prevalence was very low in the community, you actually had a higher risk of it being a false positive earlier on when the number of cases in our community was so low. But as the prevalence in the community continues to increase, the positive predictive value of that test is going to increase as well. So the increased likelihood that a positive test is true illness will continue to go up when the prevalence in the community increases as well.
Okay, thank you. I'd like to go back to Pam's comments about a motion. It was a motion to do nothing, which I think means that we don't need a motion to do nothing. We just do nothing. And I'd like to add to that.
Second it anyway?
I'm sorry?
Can I second it anyway?
I don't think it was.
Oh.
Okay, so even though it says action required, we don't need to do anything if we're not going to do anything?
Yes.
Is that correct?
It is action required.
Okay, action is required, I'm told, so go ahead with your motion, Pam.
Okay, so let me clarify before I make the motion. I rescind my other motion just so I can get this right. Okay, so you removed one of the action items. Was that number 6 or number 7 that you removed before the?
6.
You removed number 6, so that's done. You removed it before we started. Right?
I think the other actions just moved up a number when we removed one out of the agenda.
Okay, so just make sure I'm getting on the right one.
Just to
Okay.
clarify, we are on 6 and the action document was replaced with the discussion. So that's where we are right now, number 6.
I must not have the right agenda. So let me look at my fellow members' agenda here. So discussion on community health officer order.
So we're on number 6, the discussion on community mitigation options. So would your motion be for you to, your suggestion of meeting with the doctors, you and the chair,
Right, okay.
to come up with what that communication plan
So
looks
I'm
like?
going to move that Tamily, me, and Dr. Habor and Dr. Bukacek have further discussions on mitigating options for COVID in our community.
Are those independent of health officer orders, just to clarify?
Yes.
Yes. Yeah, we can't do that. We're just talking about like a PR release or something like. Well, okay. Let's say it's I'll add that to my motion that we come up with a PR statement to the community. So I amend my motion to say that. Okay. I gotta get a second before we can talk about this.
I second.
Okay. Thank you.
Okay. Moved and seconded. Carrie, can you repeat the sense of the motion?
Yep. So Pam, correct me if I get this one wrong. So Pam moved that Tamily, Dr. Highbauer, Dr. Bukacek, and Pam discuss mitigating options in our community and come up with a PR action to release in the form of a press release.
Yes.
Clarification then, in voting for this, would that mean that we are not voting in favor of any additional support of any other mitigation orders from the health department or from the health officer?
No, I believe that's
I
a
mean,
separate action item.
That's correct.
It's a separate action item, so I don't believe so.
I believe that would be a number 7.
Yeah.
Right, so I have a question of clarification as well. So in that motion that was read back to us, it sounded as if these 4 members of the board are going to come up with the mitigating options rather than the communication to the community regarding the mitigation options. So I just want to make sure.
Rather than what?
So the communication is what you're wanting to do,
Right.
of how to communicate as a board this information. I just want to make sure it wasn't coming up with those options.
Right.
It's just
No.
communicating those options.
Communicating where we are today.
Okay.
Yes.
And
I believe that we should also, and I don't think I need to add this to the motion, maybe I do, that we share a draft with the board so that they are able to give us any suggestions they may want to give us. So I don't want to do this in a vacuum. I don't want just the 4 of us doing it. I would share this draft with whoever, with all the board members to discuss.
So that's a friendly amendment. Is the second agreed?
Any?
But whoever's,
I'll second that amendment.
no, you're just agreeing to the friendly amendment.
Yes.
Okay.
I
Thank
agree.
you. Any other clarification? Since we all vote over each other, Carrie, would you call the roll?
Bukacek. Actually, do you want me to read the motion again? Because it's
Yes,
kind of
please.
lengthy.
Yeah,
All right.
Yes, please. Thank you.
So the motion is that Tamily, Pete, Pam, and Annie will discuss mitigating options in our community and come up with a press release draft that communicates what's going on. And that draft will go back to the Board of Health members for review.
Yeah.
Yay.
All right, Bukacek, yes. Berg,
Yes.
Haybar,
Yes.
Holmquist,
Yes.
Larson,
Yes.
Noble,
Yes.
Skis,
Yes.
Waterman,
Yes.
all in favor.
Aye.
No, so we're good. Nobody else needs to vote. Sorry. It was 8 yeses, the motion carries.
I'm glad we're a collegial group. I'm going to skip around the agenda, just make sure that I don't forget this. I have added a new chairman of the committee, of a committee. I've asked Dr. Bukacek to chair the Home Health Committee, which I have been chair of. I think it's appropriate to spread the wealth, put our 2 doctors in chairs of the committee that require most knowledge of healthcare, and it also relieves me of being a committee chair. Dr. Bukacek, Dr. Annie, I'll call her because I trip on that word, said she'd be happy to do that, and so she will be chair at the next meeting. And Dr. Annie, thank you for stepping up that task. Okay. At the end of the agenda today, we have the department reports. I've reviewed them all. The financial report looked to be in good order. That's one of our. Yeah, I'll come back to 7. Let's make sure we don't run out of time on this, but it looked to be in good order. I'll ask the financial officer if I missed anything. Is there anything that you need to tell the whole board, or simply request that everybody read his report? Kirk, you're on
Thank
the
you,
line?
Chair. Yes, if you can hear me fine. Everything is in good order. We're in a strong position currently. We've expended one of our COVID grants. We're currently operating on CARES funding for the current expenses for the COVID programs. And that will go through December or so, and then we'll have to start looking for another source of revenue to start covering those expenses. And other than that, so we're in good shape now, but we're going to have to keep an eye on things to make sure it stays that way.
Okay, thank you for the report. Let me go back to the agenda with number 7. And there is a document for that. It's a couple of pages long. If everybody could open. And Carrie, if you could open it for us on the computer. As I read it, there's only a very subset of things that are recommended by the report. The only one that I would suggest changing, if we're going to pass it, is the occupancy of any event. It's currently 500. We heard the discussion of the, what's the name of the?
Majestic.
The Majestic, thank you.
Tim Harmon.
That was 500. I'd suggest instead changing that to a percentage of whatever the capacity the fire department, the fire marshal says is the limit for the number of people. Off the top of my head, I'd say something like 40%. It's a 5,000 capacity, that would put it at 2,000. And that same kind of thing would apply to other events and facilities. So with that opening comment, what are the comments from the board? And Carrie, would you go around the board members?
Yep. Bukachuk.
You know where I stand on increasing the restrictions. I'd be against it, and I think I expressed it with the data already. The data supports that there's close to 100% survival. The data supports that there's an exponential growth in testing, and that's what seems to be driving the tests. We know that a so-called case just means a positive test, and a so-called active case just means a positive test that's being quarantined. And as the county attorney covered so well, there has to be an imminent threat for us to even consider mitigating, and the data does not support that with a close to 100% survival rate. And as I said, every good manager, every good military officer knows you don't give an order you can't enforce, and it's not enforceable. And in terms of causing problems within the community and causing people to be at odds with one another, I think if we need to make sense in our recommendations. I went into that in some depth in my letter to you, and we need to start, with the same presuppositions. That's it.
Okay. Oh,
Hey,
I'm sorry.
That's all right.
I muted my. Are there any other than the 500 restriction? And
as I stated in my letter, it's not logical. And as the attorney talked about, there's no science to back up specific numbers.
I understand that, but is there any other restriction you see on the following pages? Oh, the following page that pertains to meetings. There's a fixed 6 feet, which comes from the governor. Following guidance by the health department. Schools are on their own.
Mm-hmm.
But I don't see any other restriction other than these apply to meetings between 550 to 500 people.
And I agree with those that believe people should take personal responsibility. And in my particular patient population, I have had no one die from any infectious disease whatsoever or be hospitalized for one.
But I understand that, but I don't hear you cite any restrictions that are too restrictive.
I don't agree with any of them, any of the restrictions.
All right. I suggest then your recourse is suing the governor, as happened in, I think it was Wisconsin in the last couple of days.
Thank you.
Okay, go around the room then, if you would, please, Carrie.
Hey, Bar.
Yeah, I mean, I think you know where I stand on this. I am absolutely for doing something. I think we owe it to our schools. We owe it to our community to do something to try and slow the spread. As I've stated already, what's happening is not working. Dr. Bukacek claims that there's no imminent threat. We have heard from being on the front lines, I can tell you there is. I must take care of a little bit different population than she does, because I have patients who have been at the verge of death. Fortunately, I have not lost one yet, but I have had several who have been very close, and so there is an imminent threat. Even remember that a 1% death rate multiplied throughout a community of 100,000 people, that's 1,000 people dead. Is that enough dead people to make us want to act? Our community, we owe it to them to do something. And think about what Micah Hill said about the schools. If things continue to spread, even for people who may not be ill to the point that they would be in the hospital, then our schools are going to close down. And when our schools are going to close down, remember the economic impacts of that when parents have to stay home because they need someone to take care of their kids and then they can't work. So although we all want what's best for the economic well-being of our community, think about what's going to happen if we leave things unchecked. So like I said, we owe it to our community to do something. And also to the positive testing, there are some people that have minimal symptoms, but those people who have minimal symptoms can still spread things, and they can spread it in a church. They can spread it in a place that doesn't have, where they're getting close together with other people. We know the environments in which viruses spread. So we need to do something to intervene and to slow down the spread of this virus. And I think this is at least a good, it's a step. I hope that it's enough, but it's a step in the right direction. Thank you.
Carrie, this is Tamalee. Could I say something? There's been asked where we got the numbers for this. The CDC guidance says one of the ways to stop the spread of virus in communities is to limit large gatherings. They suggest that you use the number of 250. We changed that to 500, thinking we would start there because of places like the Majestic that had such an indoor capacity. As we are moving indoors, it's one thing to have people outdoors in larger groups, but to move indoors with poor ventilation in a lot of our larger facilities, it lends itself to more spread of the disease. We've had large events recently where we've had, for instance, one dinner. It was inside and the people sat at tables and they did not wear masks. We had 8 positive cases related to just one dinner. We had a trade show recently where we have one death contributed to that trade show. So as we're looking into the winter season and people going indoors, I think this is a reasonable mitigation strategy for trying to slow down some of the COVID in our communities. And I think it's so important to stop it or slow it down to keep, like Dr. Habor said, for the schools and the hospitals and our businesses.
Okay, Carrie, please continue.
Holmquist?
Yeah, I think we're treading on thin ice here if we do this, because I think it's going to be very difficult to prove the science of, you know, whether it's 50 people, 100 people, or 500 people, or 1,000 people. It's going to be hard for our legal system to figure out, you know, what's what, and it's a little bit discriminatory that we're working, you know, that we're working on the larger groups. I do have concerns about the spread in our community, but I also have concerns that we don't be challenged in a way that could reverse a lot of things. So I looked at the order. There was an MCA in there that I pulled at the very bottom of that. It's MCA 50-2-123, and it's very vague, and that's the MCA that's quoted in the rule. And it says, if a person refuses or neglects to comply with a written order of a state or local health officer within a reasonable time specified in the order, the state or local health officer may cause the order to be complied with and initiate an action to recover any expenses incurred from the person who refused or neglected to comply with the order. The action to recover expenses shall be brought in the name of the city or county. It doesn't define expenses. I don't know what that is. What is that? I don't know where you would do that. So anyway, I have some concerns. I think we need to do something, but I don't feel that this is going to fly legally. So thank you.
Okay.
Travis?
Yes, thank you. I just want to address that. I attended a meeting just before this one with county attorneys across the state, and that statute was discussed. There is a question in terms of whether or not that is the legal expenses for having to pursue somebody, or if those are expenses that are incurred as a result of the gathering. So if you're looking at events that are over 500 or gatherings that are over 500, you know, the single type events, like a gun show or a big massive wedding, or the gatherings, which arguably could include Big Mountain. I'm not sure what the daily average of skiers is at Blacktail, if that's over 500, but it might be that you're limiting those folks. And then if they do have more people than that, and the health department has to expend resources, time, and money on contact tracing, it might be those expenses. So the bottom line is, it's not entirely clear across the state on the legal minds in terms of if that's just the legal expenses, or if those are expenses related to the contact tracing and the efforts that have to result after the event or something is held. It's possible, if law enforcement was requested and did respond, and responded to that event, whether or not law enforcement type of expenses would also be included. So it's not entirely clear to answer your question.
Thank you.
Next, we have Larson.
The one question I have that Travis just brought up, so would this 500 be like for the ski resorts? I mean, did we look into, you know, kind of look at that? And then, because you can't use the fire department 40% capacity, how Bill looked at it. I mean, I get that there is a spread and so forth, and we've got to slow it down, but I'm not sure if this document is the right document. I'm kind of wondering if we should kind of look at it a little more and you know, kind of look at how are we going to do the ski resorts? How are we going to, you know, do certain events? And so that was just kind of my concerns on this at the 499 or the 40% fire capacity. So
it would not include like the ski resorts. We're talking about events like rodeos, gun shows, political dinners, weddings,
Inside.
fights that are inside. That's the kind of events that we're looking at, not businesses such as ski resorts, stuff like that.
okay.
Okay. Continue.
Noble?
I guess I kind of jumped the gun last time with, I was thinking we were on this one. So I provided my rationale in support of this. I had a concern or two on the justification of the numbers, and I think that Bill's amendment or to be amendment would suffice with that concern. Sounded like Travis thought that the MCA had, that there was a question regarding it, but it was a viable reference. So I guess I think that the health officer, if she deems it necessary, then I have to support her.
Okay.
Next we have skis.
Yes or no?
So I am looking on page 3 after the whereases into the guts of what this order does. It's pretty much saying no gatherings over 500, no more than 500 people. And gatherings between 50 and 499 must adhere to the following arrangements. One is the submitting of a plan. I've seen what those plans look like, outlining the protective measures that will be used at the event. What is the intention of submitting the plan, or the objection of submitting the plan? Is it so that organizations who want to do an event, maybe 250 people, they want to do an event, they submit the plan, and then they fear that they're going to be maybe discriminated against because it is a political event, or because it is an organization that might be a fringe organization, or it might be an organization that may not have a feeling of being protected in being able to assemble. So are you saying that they have to submit a plan, and what are we doing to let people know that this is just, it's a plan to say that you have ideas on how to protect and provide sanitation? Another concern I have on submitting the plan for gatherings between 50 and 500, which would be the allowed number of people to gather, is what about unorganized events that grow into larger than 50? Maybe it's a rally or a protest or a gathering or a march that grows larger than the 50. Are they now in violation because they did not submit a plan as to how they're going to outline their protective measures? And does this also apply to churches? Our churches are required to submit a plan for them to meet for a holiday gathering. So those are my questions with regards to that first part of this order. Is in that submitting of a plan, other than saying all plans above 500 you cannot meet, but that group between 50 and 499 having to submit a plan. And if they don't submit a plan, are they in violation of this order, and then are they prosecutable?
This is Tammy. Right now in the governor's directive, it is recommended that they do submit a plan, and many organizations do submit plans to us. We go through those plans, and they give us plans that say, yes, we can meet the governor's directive. That's 6 feet separation and the wearing of masks. The problems we've had, and I'm sure many of you have seen it in the paper, is the governor's directive right now says they have to wear masks. Many of these events submit plans to us, say they are going to make or they're going to require masking, but when the event happens, they are unable to enforce that. And so we see large events where people are unmasked. And that's part of our concern, is that these events now will be indoors, and we've already seen some large indoor events that the virus has been spread. And so right now we are reviewing plans for these. The church, that's something we need to determine. Are we going to consider a church an event? And would that again be 500 people, or would that be 40% capacity? Or would we exclude churches from this? That's something we have to decide.
So if somebody's at one of these events with a submitted plan and the attendees at an event are not wearing a mask, are there penalties for it?
Travis, do you want to answer that?
Sure, and I hope so. One of the problems with doing 3.5+ hours of Zoom meetings is that your mic may die. So I've had a couple times where I couldn't hear folks. If that's the case, I'll leave the meeting and rejoin just on another method. But so yes, the language doesn't limit things from indoor to outdoor. So it actually, as written, would apply to any gathering, including outdoor gatherings like ski resorts. It would also apply to gatherings such as church attendance. So as it's written, it's written pretty broadly. And then if those organizers of those events don't maintain the strict 6 feet, and again, it's a little bit like our businesses. Under the mask mandate, the business can, if they choose to enforce it, they can require someone, hey, you need to space out and wear your mask. If you don't, we're going to have you trespassed, and that can convert it into a means that law enforcement can react real time to the event. Otherwise, we go back to that after the fact action against this event or gathering. In which case, then we're back to that recover the expenses, which I think could include seeking recovery of the expenses expended by the health department in contact tracing. So again, there's if you want to limit things, the other thing that's of a concern, and this Tammy and I spoke with regards to spectators. And that's been changed, but right now it's any gathering, which under a technical reading of this would mean that every single Sunday that church has to have a plan 14 days in advance, or 10 days. It looks like I'm not sure I have the most recent version, but so you might think about language limiting that so that it's not a new plan every single time these regular meetings are held, and instead they can have one plan for their regular gatherings, maybe needing different ones for the big Christmas event or something like that. So those are some of the different thoughts that you folks will have to parse through, the considerations you'll have to parse through in making these decisions.
Carrie, let me take the lead for a moment. I sense that there's enough objections that there's not enough support to pass this as it is. Does anybody want to disagree with that?
So I think it's still an action item, so it should take a vote. We could do, a motion and a vote.
Could we defer that?
Is it possible to table the event? It feels like this needs to be reconsidered. I do think that we've just identified a couple of things that are just not actionable. I think that we have an intention of what the intention was. That my understanding was that we're looking at indoors, and if we have too much fluidity can we table this and come back and have a conversation about it?
You stole my words.
If I could say something, please, Commissioner
Certainly.
Holmquist.
Yep.
I think it definitely needs work. I think we have to still be careful and how we, for lack of a better word, discriminate against different organizations and different individuals. So I don't know. I guess I'll have to see what the motion is, but I still don't think I can support going over and above the governor's directive, because when you do that, as soon as you do that, then it triggers a lot of work for not only the sheriff, but the county attorney who are in the health department, who is frankly very, very working so hard now and understaffed that it's just really sad. They need help. And so it creates more work for all of them. I just hope that, again, our message, hopefully we can get a message out that will kind of make people realize that we're having a problem in our community, and please think of your neighbor. So that's my thought. Anyway, that's it. I know we're running late.
Carrie, can you verbally draft something to delay or defer, or whatever the appropriate term is, to our next meeting, or earlier, if a completed document is ready to go forward?
So what I'm hearing is that the board wants, I'm sorry, is someone saying, because I can't actually make a motion. So if someone wants to make a motion, that would be great.
Excuse me, could I just say one more thing? I'm gonna go ahead and I'm gonna make a motion that we do not do the health officer order for limiting event size. And if I can get a second, we'll see where it goes. Otherwise, we'll do something different.
Are you proposing a table? Are you proposing a table, or to cancel it all, or to not move forward it altogether?
At this time, I'm proposing that we don't move it forward at all. It doesn't mean that she can't revisit it at a later date.
That works.
So I need a second if it goes forward or not.
I'll second.
Okay, it's been moved and seconded that we not move forward on this at present.
Discussion, or do you want the roll call vote?
No, is there any discussion required? And
So so left as it is, that would not even be tabled. What I thought I heard, and maybe it wasn't an official motion, was Kyle's suggestion to table this to clean it up and come back to it at a set date, although that was not proposed as a separate motion.
Well, I believe the health officer has the opportunity to do that at any time. So I don't think we have to give her authority that she already has.
I think though, Bill, that Pete's just asking for clarification. And so there's Kyle's was never a motion. It was just a suggestion. There's a motion on the floor that's been proposed and seconded. So we are obligated to vote on it.
Okay, and we're in discussion. I'm just expressing my opinion that I think the health officer has opportunity to bring it back at any time that she believes it's warranted. So
Yeah,
is there any other discussion? Hearing none, I'll call for the vote. Carrie, would you take the roll?
Bukacek?
Can you make it super clear what we're voting?
Yeah, let me read it back. So it was a motion from Commissioner Holmquist to not enact Health Officer Order number 7, or that the board is not in support of the Health Officer Order that was proposed for agenda item number 7. So Bukacek.
I vote yes.
Berg.
Yes.
Haybar.
No.
Holmquist.
Yes.
Larson.
Yes.
Noble.
No.
Skis.
Yes.
Waterman.
No.
3 noes, 5 yeses. The motion passes.
Okay, thank you. Well, let's see, there are no departmental, we have the issue of press releases, number 8. Is there any documentation on that we should review?
There was no documentation, and that's already been a motion from Pam.
Okay, can you repeat that?
So I think that we covered that previously.
There were 4 noes and 4 yeses.
Okay.
There were 3 noes from Haybauer, Noble, and Waterman. Did I record anybody's vote incorrectly?
No.
The
So I
second and third votes were no, and 1, 2, 3, 4, 5. The 6th vote was no, and the 9th vote was no.
So there are only 8 votes.
Yeah.
And there were 3 noes.
8th vote. The 8th vote was no. The
Yes, that
6th
was Waterman.
The 6th vote was no, and the 2nd and 3rd vote was no.
No.
So Berg, you are the 2nd vote, and I have you down as a yes. Is that correct, Bill?
That is correct.
Okay, so we are good on 3 noes, 5 yeses for that motion. So that gets us through item 7. I believe item 8 was covered by Commissioner Holmquist previously with her motion, which gets us through items 9 and to 10 or 11, if you want to go through those.
10 was simply raising the questions on any department reports. The only one I asked for clarification, it was the financial. We're in good financial shape. We'll meet again in 4 weeks and get an update. Is there any other business?
I have some.
Okay, health officer.
It's not business, it's just a statement. Our office is drowning in COVID cases right now. We have 29 temporary staff. We have 11 of our regular staff. Our staff, we're losing people every day who have been at the health department for years. This is a really hard job. It hasn't gone on for a week or a month. It's gone on for 6 months. So our ability to contact trace right now is diminished. And so we, in the past, have wanted to do that contact tracing within 24 hours. Our ability now, we're getting 80 to 100 cases a day. It's going to be pushed back to 2 or 3 days. And that will increase the spread of the virus throughout the community. We'll do the best we can, but this is an impossible job. It's really hard on the employees, and we are put in an impossible position.
And any board member comments? And I'll be last.
Go around the board.
Yes, please.
All right, so let's go with Bukacek.
Well, I just wanted to make sure people understand that this stress to the staff, any shortage of PPE, any of those kinds of things, it's caused primarily by the directive, not by COVID. And I think that's really important that people understand that.
Next, we have Haybauer.
Yeah, I am concerned that we are just passing this, taking action down the road. I would encourage us to come back together in short order with an updated proposal from Tamalee with the concerns addressed that would be submit for revote. And I know now is not the time to make a formal motion in that, capacity, but I don't think we can wait until next month, given the logarithmic growth of activity in our valley. So I would urge us to consider addressing our concerns regarding making some interventions and to redress this in short order.
Holmquist.
I again would like to thank everyone for their comments today. I especially want to thank Tamale and the health department, because I know they are under some major stress, and the healthcare community is working diligently too. And I know that. I hope that when we get our message out there, we can get more buy-in, I guess, from the community on trying to, like I said before, take care of your neighbor, be respectful, be mindful to your neighbor, and we don't have to do these things that we think we're going to be forced to do. So that's it. Thank you.
Larson.
I want to thank Tamale and everybody who have been working hard on this COVID and so forth, and that we do need to try to get a handle on it, but I'm not quite sure how to do it. And so, but I want to thank everybody for their comments as well today. And thank you guys.
Noble.
I don't have any additional comments right now.
Skis.
I would like to repeat all of the thanks to the staff. We have incredibly hardworking staff that are putting in a lot of hours and sacrifice to be able to keep our community safe. And so I really want to honor their hard work and Tamale's hard work to move into that, to lead us through this difficult time is honorable, and thank you. To the people who gave us public comment. You know, I've been on this board for almost 5 years, and this is the first time I've seen our community actually engage in what it is that we do, and that's exciting. I hope that once we are able to navigate through the crisis that we're currently facing, that the community does remain engaged, because we are about public health. And there are a lot of things that we do in public health outside of this emergent crisis that really needs to have community buy-in and community support. So I appreciate everybody being involved.
Waterman.
Thank you. Again, my heart goes out to the staff who's doing a lot of work here. I am concerned as a board member here and as a city council member that we're not taking enough action. And I do hope that we will come together again soon to take action. I agree with Ms. Skis that public engagement is really important. The transparency, I think we need to be working better on that. But I think that also we are being asked to take action, and we are in a moment of crisis, and we've had reports of what our department is in crisis with, but also what our community is in crisis with. And I think that, again, I do hope that we move to take action with this board, because it is a state mandate that the city be involved in this and that the county be able to address these public health issues. And there are some of those. And like I say, it's not just about COVID. It is also about the other health events that we are experiencing. Winter is coming. We have the flu season. We have other things that we need to be concerned about as well. And I do hope that we can find a way to be taking action on COVID so that we can get to the other issues as well.
Carrie, am I last?
Yes, you are last.
All right. Well, I've heard everybody thanked, and I want to just repeat that. I won't say everybody's name, but I know the lady sitting next to me has been working very hard. The entire department has. I also want to thank Carrie for orchestrating all these meetings and the participation of all the legal, and the sheriff was not here, but his representative, and all those that at the hospital, the doctors, and particularly the members of the community that called in a row. To keep this thing going, there's somebody in our group that I really want to get special recognition to, And the best way to put it up here. Let's see if I won't be able to see it because I'm blocking it.
It's there.
That must be for Carrie. Love it.
Okay. And I'd like your advice and consent to give this to her personally at the end of this meeting. Are there any objections?
Wonderful.
Hearing none, we have no business. Meeting is adjourned until next time. Thank you all.
Thank you, everybody.